Hi, my name is Taylor. I'll be doing my wound care test out today. So the first thing I'm going to do is I gave my patient his pain meds 30 minutes before this at 6:30. It's now 7, or I gave it at 7 because it's now 7:30 p.m. So my person is Bill Johnson. His date of birth is 3/16/XX, and he does not have any allergies. So I gave him Tylenol, 625 milligrams by the mouth for his pain 30 minutes ago, like I said. So I already did my 3 med checks with this, and I did my 6 rates of medication, med administration. So first thing I'm going to do is gather my supplies. So I have 3 cotton tip applicators, a little kit, and a lot of sterile gloves. Okay, so I'm gonna knock before I enter, and I'll say, I'm gonna close the curtain quick, and I'm just gonna say, hi, my name is Taylor, I'll be your nurse today. I'm gonna wash my hands here. Okay, and what I'm gonna do first is I'm just gonna check your name and date of birth. So it looks like Bill Johnson, okay, and 3/16/XX, and no known allergies, so that's good. You look like you're in a safe position. So basically all we're gonna do today is a wound care change on your pressure ulcer. And also, how's your pain? Is it good? Okay, it kicked in? All right. So now what I'm gonna do first is I'm going to wash my hands here. I already did my K-wipes, washed my hands, introduced myself, privacy explained, checked my patient's wristband, gave him his pain meds. All right, so Mr. Johnson, I'm just gonna peel back your dressing. Oh, before I do that, I wanna pull this down here, because he was in a safe position, but now I'm on the side of him, so it'll be okay. So wash my hands. And all we need is clean gloves just to take off this dressing. All right, so I'm gonna take the dressing off parallel to the skin, and I'm gonna do it all the way around, trying to do it carefully so it doesn't hurt him anymore, because he already probably has a little pain. All right, I'm gonna take this dressing away from the patient so they can't see it. I'm gonna observe what's on it, and if there was anything, I'd note it, but I'm just gonna fold it in half, and I'm gonna dispose of it, and I'm just gonna keep it for the next video, so, for the next person. And then I'm gonna grab this out here. I'm just gonna roll it up in my hand, and then here. And to add, this is already here, but I would ask the patient if I could pull the blanket down and the dressing up, his little shirt. So that's good. I got the dressing off. He said it was okay when I did all that, and the patient's still doing okay. So next thing I'm gonna do is I'm just gonna palpate the wound with some sterile gloves here. Just gonna grab the corner here, throw that away. Okay, open these up. Trying to only touch that 1-inch border there. And I don't want to cross my sterile field here. Again, only touching that 1 inch. Okay, and then this side. Again, only touching that 1-inch border. really what you want to do is make sure that these don't fold back on. Don't ever cross your sterile fields. We're good. So now I'm gonna wash my hands here, not crossing my sterile field. Okay, I'm just gonna grab this one. Now that I'm keeping everything sterile, I just want to make sure that I keep my hands above my waist and my patient's above my waist here. So that's on, only touching that cuff there. And then bring my hands over here, right in here, and it's all sterile. Okay, so I'm just gonna tell the patient, okay, I'm just gonna visually assess first, look at any bone or slough, redness around it, tenderness. And then once I've visually assessed, I'm just gonna palpate here, so I'll warn the patient. Ask them if they have any pain as I'm going, any tenderness, and it looks pretty good. So I'm good with palpating and visually assessing. So now that I'm done with that, I'm going to take these off here. Don't need the sterile field anymore. Wash my hands. Grab these, put them over here. Wash my hands again. All right, so I'm gonna open this away from me. Just grab on it there. Okay. Just being careful here not to touch any of that sterile part. And then I'm just gonna drop that there into the garbage. And again, when you open it, try not to touch these sides here. Just to keep it sterile, I grab under here, okay? So, I'm gonna wash my hands again. And just so you're not crossing it, I'm gonna grab out your gloves. And I'm just gonna set those here for now. And I'm gonna go grab this sterile field here. Just gonna open this away from me. Try and only touch the corners here. Okay, just gonna pull these. All right, I'm gonna move these over here. Grab my hand sanitizer. And I'm just gonna pull this over a tiny bit here. Okay, so I'm gonna go ahead and wash my hands. And I'm gonna open these. Then I checked all my equipment, made sure it wasn't expired. And one thing that I wanna make sure to do is keep my 1-inch border on there. Go. And then I'm gonna wash my hands just because I put my hands down for a second. And then I'm going to open one more pack here. There we go. Okay, so now I'm gonna wash my hands. And all that is open, keeping the 1-inch border. Just wash my hands. And I'm just gonna try to touch the outer parts here. Spin this around. Just touching that corners and that outer 1-inch, not trying to cross any part of that sterile field there. All right, so that's all open. Wash my hands directly before. Okay, very careful carefully, I'll just grab this cuff here. Keeping that cuff only touching in the inside and not the out. Slide that down as much as I can. Okay. I'm going to grab this one here. Keep my hands above my waist. Oops. Grab that there. And there we go. Gloves are on, good. Keep that sterile field, and what I'm going to do is just grab out the rest of my things here. Just going to get rid of this. This is the bag I'd use for the dressing if it were to be gross from the wound change. Keeping that 1-inch border. Okay. Label. Gonna set up my measuring here. Try not to cross that. 1-inch border for that too. And lastly, I'm just gonna get this out here. Keeping my hands above my waist. Set that down. And then I am going to grab my little gauze roll here. Need some gauze things for drying. Okay, so these are for drying. Just gonna set those there. And then these ones are for cleaning. Okay, I'm gonna grab this here. Okay, just gonna set this here for a second. Putting that up there. Not dropping my hands below my waist. And I'm just gonna get these wet here. My roll wet. Okay, and then I'll just put my cover on, and it should look good there. So I'll just set that on there. All right, so the first thing I'm gonna do is measure, and I'll have my partner be writing this down as I go. So I'm gonna measure the length first, not touching the patient here. Okay. And that is 10 centimeters. Next I'm gonna do the width. It looks like that is 7 centimeters. Next I'm gonna do the depth. Again, not touching, so my gloves are so sterile. And that is about 4. And since I did just touch in with that, I'm gonna drop that swab, grab this one here, and I'm gonna do the tunneling. And it looks like that is about, we'll say 5.5. And lastly, I wouldn't put this one in because I just touched the patient with that one. So we'll take this one and I'll do the undermining here at the deepest part. Okay. Again, not touching the patient or the inside, so my gloves remain sterile. And that is about 3.5. Not dropping my hands below my waist. Okay, so I'm done with that. It's no longer a sterile field. But, all right, so I should be good to go for cleaning. So I'm gonna grab my first thing here and really wring it out because you don't want it to drip over anything sterile. All right. Okay. And now I'm just gonna clean from in to out. And the wound doesn't look too bad. So I'll get the undermining there and the tunneling. Okay, and that looks about clean, so now I can dry. Okay. So, gonna clean around here. Make sure to get the tunneling, the undermining. Looks good, nice and clean. Drop that. And now I can start to pack my dressing. So before I do this, I'll just make sure that my patient's doing okay and yeah, just want to make sure they're all good. So, all right. So now what I'm going to do, this part gets a little tricky. You just want to make sure that when you're packing, you want to try your best not to touch the sides here. But if I do, I just say I would start over, but for the purpose of this video, I'm just going to try and do it the best I can without touching. Okay. Get that tunneling. Make sure it's not touching. Okay, so I touched a little bit there, but for the purpose of the video, I just keep going, but you would definitely I would just start over with this and make sure that it remains sterile. Okay, so we're just gonna loosely pack that. Okay, looks good. And I'm gonna drop that. Grab my scissors. Don't know why I'm shaking, I always shake. This is ridiculous. Okay, I'm okay. Okay, so that looks good. I'm just gonna set this over here and I can drop this. And I'm just going to grab in here and make sure that that's all packed down good. And again, like I said, I did the best I could without touching, and if I were to touch, I would just redo it. So that looks loosely packed. I got the undermining, the tunneling, and that should be good. So now I'm going to grab onto this here and make sure my patient's doing okay. Set that there. And now I'm gonna tape. And when you tape, you just wanna make sure that you don't tape too much because you don't want your patient's skin to be even more damaged than it is. So try to do the least amount of tape that you can with it staying on good. Okay. And lastly, we'll do one more here. Ooh. All right. Make sure your patient's doing okay, pain's okay throughout. And then lastly, I'm just gonna take these off now. And I'm gonna wash my hands. Got my pencil. And I'm just gonna do the time, and it's 7:30 p.m. And the date is 4/19/19. And I'm gonna put TF. Okay. So I'll put this on my patient. I'd cover him back up. I'd give him his call light. I'm gonna put his bed back in a safe position here. And make sure he's doing okay. Give him his call light. Bed's in a low position. Safety's good. Make sure he's tolerating it okay. So we're okay. All right, let me know if you need anything. And safety's all good. Checked everything. So now I'm gonna wash my hands and go document how it all went. So this is my partner's measurements that she wrote down. All right, so the first thing I'm gonna do is do the date and time. So it was 7:30 p.m. and the date is 4/19/19. And I'm gonna do, what did I do? I used the ABD pad. I used sterile gauze to pack. I used dry gauze and then just tape, and then the label's on there. And then I would do, if there's any odor, and there's no odor, any redness, no redness, tenderness, swelling. I do how my patient tolerated it, so I'll say no pain. Patient tolerated well. So no pain, patient tolerated well. Said no odor, no redness, and then I'm going to do my measurements here. So I'm going to say that my length was 10. My width was 7. Depth was 4. Tunneling 5.5. And lastly, undermining 3.3. Also, what I would include on this is Ashley talked about saying that the patient is, like, this would be 12 o'clock, so I would put the undermining at, I'd say, like, from probably 7 to 1, and then the tunneling is probably at about, oh, sorry, I'll say from 9 to 1, and then the tunneling's about a 7. So I'd write that. 7 o'clock. And then the undermining, I'd say about 9 to 1 o'clock. Okay, so I have all that for the patient. He tolerated it well, no odor, no redness, tenderness, swelling, drainage. I'd note anything that I saw in my visual assessment. And I think that's pretty good, so I'm just gonna sign. Okay, and I'm gonna initial, and then I'll just do the date one more time down here. 4/19/19. Okay, so I should have everything on there. Like I said, I did my med checks, all that for the Tylenol. Oh, I should probably write that on there, huh? So I gave it to him at 7 o'clock p.m., half hour before. So I got that there, and I'm just gonna initial that and put 4/19/19. All right, so I think that's about it, and I would have cleaned up all my stuff and washed my hands before I document, so that should be it. Thank you.